Welcome to the Functional Neurologic Disorders Society podcast. I'm your host, Erica Cotton, coming to you from Chicago, Illinois, with a special thanks to Michael Romeo, our production engineer, coming to us from Australia, and our content curator, Ingrid Hertzauer, from the UK. This is a 3-part panel series exploring FND across the international arena. Part 1 includes FND diagnosis, access, and discussion of treatment landscapes. Part 2 includes FND culturally relevant factors within the biopsychosocial spiritual model, and Part 3 covers FND research, funding, and international collaborations. My gracious guests include Dr. Lucia Tesolin, currently in Peru, but with prior experience in Italy, Great Britain, and Switzerland. Dr. Sonja Rutten from the University of Amsterdam, the Netherlands, providing input on the Dutch and FND. Dr. Takamichi Kanbayashi from Tokyo, presently learning FND in Edinburg, the UK. Dr. Lucas de Andreas at the University of São Paulo, Brazil, Dr. Chrisma Pretorius at Stellenbosch University in South Africa, and Dr. Sanjay Pandey, presently in Delhi, India. As a host, these conversations felt like a window into the world of FND across the international landscape, seeing what FND education, practice, care, and research is really like day to day in these different regions. I found these speakers, their work, and their perspectives to be so thoughtful, commendable, and inspiring, and also a clear highlight of just how much work there is to be done in FND across the world. I hope you enjoyed this series as much as I did. Well, thank you so much, everyone, for joining me for this discussion. I'm so excited to hear from everyone, and joining me from so many different places and so many different time zones we have here. But we're going to get started with Lucia, who's going to talk about existing services in Peru.
Hi, everyone. Thanks for inviting me. So I'm Italian, but I'm conducting a research project in Peru. And talking about the services for FND in Peru, right now there is nothing. They are still using the ICD-10 classification. So it's quite difficult to make understand the neurologist that it has changed a bit and that the management of this disorder has to be done from a neurologist. And there are 3 types of services, of medical services, one public, one private, and one is middle, like in the middle, partly supported from the state, from the Ministry of Health. And I'm actually working in this one because it looks like to be the most efficient or most professionalized, and the neurologists are really interested in learning and in learning the guidelines to diagnose FND and all the signs, the clinical signs, because they are actually not using it. Usually, the diagnosis of FND is made by psychiatrists, and also the follow-up. And usually it is diagnosed as a anxiety disorder or depression disorder, or these are the mainly the codes added to this disorder. And regarding the treatment, usually they provide psychology treatment for free to people because this type of service that is mixed between private and ministerial and country and governmental. It provides psychological support for free, but it's just too short because usually it's like 4 sessions, 5 sessions. It's not too much. And the main problem is that usually people should wait a long time to get in the list and to receive the treatment. So it's not so quickly. And usually neurologists don't send the patient to physiotherapy. So it was a new way of management of this disorder. Right now, I'm there is another problem that all the insurances doesn't cover, private insurances doesn't cover for psychiatrist problems. So one problem is what to do with FNDs, because since it is still in the ICD-10, it is considered as a psychiatrist problem. So yeah, these are the mainly problem I'm looking for. So a solution.
Lucia, that was an excellent summary. And also bringing in just the different governing structures or healthcare structures. I don't know why I didn't necessarily assume that we would naturally bring in that part of the discussion. I thought we would stick within the medical system, but of course there's larger systems involved, including medical structures. And, interestingly, we have often the same problem here in the US, where it's still FND is diagnosed as a psychiatric condition, and then insurance won't reimburse, or disability won't reimburse, or workplaces won't acknowledge the condition as a disability because psychiatric rather than neurologic. Really excellent summary.
Yes, just to add a thing, the last problem is that usually the patients that have a disease go through a disability state that can be temporary, and then after 6 months, I think it converts to long lasting. So that's a problem for FND, because usually my patients now are going through a disability state temporarily, and then if they are not getting better in 6 months, the neurologists have to convert them to long-lasting disability, and then they lose work.
Oh, wow.
Because the jobs, the private jobs, don't understand that it can be a disability that can get better in a little bit of more time.
Yeah, great awareness to the issue in Peru, and the challenges that are currently there with the existing services. Sonja, would you like to tell us about the existing services that are currently in the Netherlands?
Yeah, sure. Yeah. Well, I recognize some of the problems that Lucia and you describe when it comes to the division between psychiatry and neurology, unfortunately, especially when it comes to disability, etc. I think in the Netherlands, we overall have high quality healthcare, and we have mandatory health insurance. So healthcare is accessible to everyone in the Netherlands. So I think that's a good thing. The care is then paid for by for-profit insurers, and that causes some problems because not all types of treatment are covered by the basic healthcare insurance that is mandatory in the Netherlands. So we have a lot of different services in the Netherlands. I think that quite a lot of physical therapists actually have been educated to treat FND properly. There's a growing interest in that group. So usually you can refer a patient to a physical therapist. They don't have long waiting lists, but there is a problem with insurance companies that don't cover the treatment for everyone. When we look at psychiatry services, it varies over the country. Some regions have very excellent services and others don't have any services at all. The Netherlands are quite small, so that shouldn't be a problem, but we do have long waiting lists for psychiatric healthcare, for mental healthcare in general. So you see that sometimes people will not get accepted if the mental healthcare provider is outside of their region, because they try to limit the waiting list. So sometimes they don't have access to these services, or they have a very long waiting list, which of course is not good for the prognosis. And we see that there are still psychiatrists and psychologists that are not particularly interested in the group, and which is very odd to me, because I think it's the most fascinating group to work with. But we see that some of them are not well educated when it comes to FND, and we still see misunderstandings, stigma, etc. And that's not only in psychiatry, that's also within neurology and other fields of healthcare. We used to have rehabilitation as an option for FND, but that has changed as well. So we can't offer rehabilitation anymore because it's not covered by healthcare insurance, which is a shame because a lot of people actually need multidisciplinary treatment. And now we have to try to, make that work with a physical therapist here and a psychologist here and a doctor there. But overall, I think we're doing pretty good. I'm not, especially when I hear Lucia saying there's not much in Peru, I'm like, I shouldn't be complaining too much.
Oh, that's wonderful to hear, Sonja. Yeah, your quick access to good physical therapists who are well trained. I'm like, oh my gosh, I have like 2 physical therapists that I can refer to reliably, and all the others are just untrained. So that's a wonderful asset that your country definitely has capitalized
I wanted to add
on.
one more thing, if that's possible. I just remembered, I think that in the Netherlands, it's quite unique that a lot of patients are treated with hypnotherapy, but also induction of catalepsy, which is not used in other countries as far as I know. So that is always nice when you meet people at conferences, etc., from other countries. You hear that is not common, while in the Netherlands, most people start with either physical therapy, hypnotherapy, or induction of catalepsy before they even get referred to mental health care. So that's a difference.
That's wonderful. There's an earlier podcast that's not out yet, but I think it just got posted, a Daniel Claus episode where we talk about chronic pain and just alternative therapies and actually what he views as really effective therapies. And this is reminding me of that, right? Like hypnotherapy and induction of cataplexy, we would characterize as, alternatives for some reason. But they actually, I think, it's regionally and culturally, and if it's successful, then could be more widely adopted with benefits. So it's great to hear that. Thank you. Wonderful. Okay, next on the list, we have Takamichi to tell us about services in Japan.
Thank you for asking, and thank you for having me. So, from my perspective, at the moment in Japan, so there are very few outpatient clinics specializing in FND, and the patient support groups for FND also quite limited. But recently, the Japanese Society of Neurology established a special interest group for FND to improve care for FND patient, and this group consists of approximately 20 consultant Japanese neurologists, including myself. But still, this group has just started. So, but we are planning some educational activities, such as a half-day or one-day webinar lecture to help neurologists understanding of FND. And, probably this is the same. This problem is probably the same in other countries. The diagnosis and the treatment of FND are often avoided by many neurologists in Japan. So I think this is because awareness and knowledge about FND are still insufficient. So we need to address the knowledge gaps and misconceptions surrounding FND. In terms of web services, unfortunately, well-developed websites that provide patient with extensive information about the FND are also quite limited, I think. And also in terms of education in medical school, FND is rarely covered in the curriculum in Japan. So this lack of exposure means that many future doctors graduate with limited knowledge about FND which can lead challenges managing FND and recognizing FND. I think it's one of the major problems in Japan. Yeah, thank you.
Thank you so much, Takamichi. You're 100% correct. We have the same issue here in the US with training. Actually, the podcast that David Perez and I did, he's so passionate about education and needing to build in education, FND education into the medical student, medical resident training models and fellowships, because it's similar. I think, people really only get well trained if they're in a center that has an existing FND unit with it and happen to want to specialize in that. But outside of that, the training and access is very rare and very limited and probably pretty outdated, I would imagine, here in the US as well.
Yeah, exactly. Yeah, thank you.
Wonderful. Thank you, Takamichi. Lucas, would you want to tell us about existing services in Brazil?
Sure. Thank you all for the invitation, and thank you, Erica. So in Brazil, the existing services are scarce and not very well known among themselves. But the main centers for study of FND are currently located in São Paulo, at the Institute of Psychiatry of the Hospital das Clínicas, where I am a part of, and in Santa Catarina, where they have specialized more in psychogenic non-epileptic seizures. In general, in other locations, FND cases tend to be interspersed within general neurology or general psychiatry outpatient clinics, which is a big issue in my opinion. At the Institute of Psychiatry, we have a neuropsychiatry ward where we can admit patients with suspected FND to complete their investigation and guide their treatments, including physiotherapy and psychological support when necessary. And additionally, we have two FND outpatient clinics. One is called SOMA, led by Dr. Bruna Bartorelli, which covers most of FND subtypes except PNES, psychogenic non-epileptic seizures. And treatment here focuses on group psychodynamic therapy, specialized physiotherapy for FND, and medical follow-up with neurologists and psychiatrists together. The other clinic is called Progepsi, led by Dr. Renato Marchetti, which focuses on the diagnosis and treatment of PNES. And in this clinic, all patients are admitted to a video EEG service for a few days to conduct differential diagnosis and perform hypnotic induction in cases of PNES. So we induce the occurrence of the PNES during the video EEG monitoring. After the diagnosis, the patient is referred for psychiatric and neurological follow-up, along with psychotherapy, focusing on PNS, using a specific CBT method developed by one doctor of our group called Daniela Kirkent. And all of these evaluation and treatments are free of charge and provided by the Brazilian healthcare system, the unified health system. So this is a little bit about our work.
Is anyone else just really amazed that he just said, and all of these services are covered? Sorry, this is wild for us in the US. These are not guaranteed services or coverage. Wow, that's amazing.
And there is one thing more. Almost all of the doctors and physios and psychotherapists are voluntary, so they don't get paid for this work.
So my mind is struggling to do the math of that. So the services are covered, but the providers don't get paid. Is that how the services are covered? Is that how it works?
Yeah, mainly in the healthcare system in Brazil, especially in the hospitals that are related to universities. I won't say almost everyone, but most of the professionals do the work as a voluntary work.
We could have a whole different podcast on the medical training structures and medical pay structures in different countries and how that works. That's mind-blowing. But I was, as you were talking and you said you admit patients to a neuropsychiatry floor for this sort of seeming multidisciplinary. When you say admit, do you mean you admit them inpatient? Like it's an inpatient, they come into the hospital? Yeah, you're nodding. That's a yes. Yeah.
Yes, they come into the hospital and they become an inpatient. So they spend a few days doing investigation and rehabilitation and whatever they need to assess the diagnosis and treatment.
That's wonderful. Yeah, I was just thinking about how that would work in the US, and I feel like we're more fragmented. They would be admitted either to neurology or they would be admitted to psychiatry. But if they have a neurologic condition, they're not going to be admitted to psychiatry. And then they have to go to a different place if they want therapies or rehab, and that's a different admission. And they'd be in, 3 different places. And wow, that's wonderful that you guys can offer that there.
It's the first ward in Brazil. So it's our ward, neuropsychiatry ward. It's the first one in Brazil, and I think it's the only one in Brazil.
Well, it sounds like it sounds like a dream come true model for all of us. I think we'd all love if we could, well, at least me in the US, would love if we could have all of those pieces be combined. We're more siloed, but what an excellent model. And thank you for doing that, because then it demonstrates feasibility, utility, right? That you can generate appropriate patient care and appropriate provider utilization by using these models and combining care in that way. Thank you. That's wonderful. Chrisma, would you like to tell us a little bit about existing services for FND in South Africa?
Yes, Erica, thank you for the invitation and the opportunity. Listening to all the other people, I'm quite jealous of some of the services that's available in other countries, because it's a very different picture in my country where I come from. So in South Africa, FND is recognized within the medical community, but specialized services are very limited. Existing research in the country suggests that FND are frequently diagnosed. However, we also have the public health system in South Africa that's heavily taxed by the majority, about 86% of the citizens seeking medical attention. And there is a paucity of health professionals working in the public health sector when compared to the population it serves. For example, just to give you an idea, we have about 10,800 patients per specialist in the public health sector, compared to 420 patients per specialists in the private healthcare sector. And furthermore, in South Africa, we have roughly about 150 neurologists that's equipped and skilled to treat patients, but only a handful, about 35 of them, work in the public sector hospitals that treat the majority of the people in the country. And then just some other statistics. Out of the 5 known video EEG facilities in the country, 3 are located in private hospitals. So the access for the majority of people are mainly non-existent. And sadly, the private healthcare sector caters mainly for middle and high income earners and attracts most of the country's healthcare professionals, even though they cover less than 14% of the population. So a very skewed picture that I'm painting. And I suppose the bottom line is comprehensive multidisciplinary treatment programs in South Africa are very scarce, especially for FND. And access to specialized care remains a significant challenge. And where FND is treated, the services are very fragmented as well. People work in their own little silos. People don't work together and collaborate. Psychology services are very limited. So overall, not a great picture.
That is so interesting to hear. It's interesting because everyone has sort of different types of problems, like whether FND is recognized versus service access versus which service you can access versus is it covered. And it's so you started out so strong with FND is well recognized in the medical. I'm like, oh, that's wonderful. Great record. Oh, but we can't get services, or service access is highly unequal or disparate across the different settings, practice settings, whether private versus public. And not having multidisciplinary centers for FND just seems like such a missed opportunity for patient treatment for a condition that is, seemingly well known and diagnosed, right? Which is wonderful. Yes, win. But we're not actually, doing not actually providing the resources to engage in more standardized treatment centers like multidisciplinary approaches that are just so essential. So a mixed bag of problems within South Africa. Oh, interesting. Yes. Fascinating. Sanjay, do you want to tell us about existing services in India?
Yeah, so if you see the Indian population, it's a huge population. So 1.2 billion is the population, and 31% of the population lives in urban areas, and the rest lives in the rural areas. So 1/3 in urban and 2/3 in the rural areas. And we have a mixed healthcare system, around 20% public and 80% private. However, most of the private healthcare providers are concentrated in urban areas. And government provides the public healthcare system as a three care system like primary health, secondary health, and tertiary care like university teaching hospitals. So if we see the majority of the patient come directly to the tertiary care centers in urban area, so they don't follow this model because of the lack of neurologists we have. And if we see the neurologic, psychiatric and rehab services, they are mostly in medical colleges or tertiary care private institutes. And there is extreme shortage of these services. Like for a 1.2 billion population, there are approximately 2,000 neurologists only in country. That is extremely less in compared to the Western countries. And if you see the diagnosis of FND, it is mostly made by neurologists, but some cases are also diagnosed by psychiatrists or general physicians who are treating patients at primary or secondary care level if they are trained. But that is rarity rather than rule. Most of the patients are diagnosed clinically as electrophysiological tools are very, very less. Even if they are there, people don't have idea how to do it, like surface EMG, bright chart potentials. So there is a maybe lack of technology, lack of manpower who can use these technologies, and that is very obvious in majority of the countries. And if we see then in our setup, the cognitive behavior therapy is not widely available. So even if we diagnose it, our center is one of the center where CBT is administered. But if you see the other centers, most of the centers cognitive behavior therapy is very difficult to get. And there is a huge waiting list for getting this therapy. And that becomes very challenging in functional patients, especially when they present in acute stage or during emergency. It's really challenging to provide CBT to those patients. So if we see the problems, what we are facing is one of the lack of time, like the amount of time we give to our patient, because the encounter time is very less. Sometimes we have to see around 40-50 patients in a day, and FND patients require time. So the time we give is maybe 5 minutes, 3 minutes, and that is very less to make a diagnosis or to make a maybe meaningful encounter. And there are very few neurologists who are interested in treating these patients because they are overburdened by other disorders like stroke, epilepsy, headache, and infection-related disorders, which are very common here, like tuberculosis and neurocysticercosis. So the priority is very low. Even if you ask the government for funding, the fundings are not easily available because this is very, very low priority area to do a research. And so these are the realities of FND care. And we don't have any FND clinic as such in any of the centers. But some of the teaching institutes are gradually picking up and they're trying to establish. But in true sense, none of the center is providing any dedicated FND clinic for the patients.
That's really fascinating and somewhat sad to hear, Sanjay, that the services are so limited. But it sounds like a wider sort of population health triage crisis almost, where it's, just get health services for these sort of higher acuity conditions, and then FND sort of falling on the back burner, sort of in the fringes in terms of services, both diagnostic services and available treatment services. Wow, major challenges there. But excellent that you are bringing awareness and starting to increase familiarity and validity of the condition and raising the priority of the condition. That's wonderful. I want to be mindful of our time, but I'd like to run through everybody again and hear if anyone has any possible solutions, or if they'd like to further discuss their barriers if they didn't already discuss them. But any possible solutions that you could identify or ways that your countries could move forward with expanding FND care and FND access, or what would really make a difference or would need to happen in each of your locations? Brief answers are fine as well. Let's start back with Lucia. Possible solutions?
Yes. So I just want to add something to the previous talk. So the other problem is that mainly most of the population lives in Lima, that has like 12 million people, but other 30 million or 40 millions do live in the province. And in province, there are no neurologists. Just in free province, there are neurologists. So mostly people do have to travel to Lima to get a specialized neurological evaluation. And that is another problem. And what happens in province that usually people do ask for curanderos evaluation. So for the savior of the population that usually suggests medical therapies, natural therapies, alternative therapies. That is another point and another difficulty. And about the solution, I think teaching about FND is the first solution. So teaching starting from universities. And usually another solution could be doing a training between residents, because they are quite interested and they do listen to FND's problems, FND diagnosis, but they really don't know how to manage, how to treat it. So they do know what it is, but they don't know how to manage it. And also between a professional, health professional like a psychologist, a physiotherapist, speech therapist. And another solution, I think, could be to make up a group, a Latin American group of professionals of health. That is a point I'm working on. For example, there are different services in Chile, in Argentina. So just put together all these professional institute or universities and doctors or professional health system that do work on FND, and to make for example trainings online to teach to the therapists here as well how to manage these disorders.
Those are wonderful insights, Lucia. I think a common echoed theme I'm hearing is this teaching, the necessity of education, teaching, especially management, diagnosis and management in certain cases, but especially management when it comes to Peru. And then, limiting silos and increasing multidisciplinary communication and professional communication, and the benefit of having more regional professional groups that have similar access, similar issues, and possibly then can share similar solutions and strategies. Yeah. Thank you, Lucia.
I think it's quite difficult to look for a similar example in Europe. So to put in contact people from Latin America is better, because they do see that countries close to them do have better solutions, so it can be easier.
Yeah. Better partnerships or easier working collaborations. Great, Lucia. Thank you. Sonja, what about you? Possible solutions in the Netherlands, although your services are pretty good in terms of high quality healthcare, but
yeah, they are, but we could use more professionals who are interested and well trained. And I think every solution that Lucia just mentioned also applies to the Netherlands. We need better education for all healthcare professionals when it comes to FND in regards of diagnosis and management. I'm also thinking that we as an FND community could benefit from each other's knowledge more. So every effort to share information regarding successful treatments, treatment manuals, websites that provide patients with information. I think it would be so much better if we would try to share that even more than we are currently doing, for example, via the FNDS, because I feel that everywhere everybody is trying to, I'm not sure if it's an English expression as well, reinventing the wheel, like trying to figure it out for yourself. Well, there is so much out there already. And I think working together, sharing stuff could help everyone around the world, basically.
Yeah, sharing resources is such an untapped opportunity, I think, and to briefly revert back to barriers, I think one of the barriers, at least that is associated with that in the US, is proprietary property. You make a treatment, you publish a workbook, but then whose property is it? Can it be translated? Can it be used in multiple countries? But then who gets the profits from that? And sort of then you pull in this complexity that's completely unnecessary. It has nothing to do with helping patients.
Yeah, I personally feel like healthcare and people's health shouldn't be something you make money off. I mean, we should just share and try to make everyone better. And well, that's my personal opinion. I think it's a shame that people work with these copyright, etc.
Yeah. Oh, it's a major challenge, and a major limitation for sure. Yeah. Takamichi, can you talk about any potential solutions or next steps that you'd like to see in Japan?
Yeah, thank you. I completely agree with others' opinion. Yeah, also teaching and establishing educational system for FND is very important. And so in Japan, to improve this situation, I think we need to promote accurate knowledge about FND, not only healthcare provider, but also to general public. I think it's also important thing.
Yeah, that's a great point. Thank you. Yeah, it's not just about the providers being educated. There is so much stigma that a person feels within society when having an FND diagnosis. Not stigma, lack of awareness. People don't know it. I mean, if people say, "Oh, well, you had a stroke," or you have seizures, there's some usual awareness or recognition from the general public. But FND, it's like, phew, straight over people's heads. Or they're, what's that?
What's that? Yeah,
point.
That's right. Yeah.
Great point, Takamichi. Thank you. Lucas, what do you think about potential solutions or additional things needed in Brazil?
Well, in my view, I think that, and it's a consensus among us, the main barriers are the lack of quality information and education, both for general population and healthcare professionals. And I agree with Takamichi. Many people see this type of condition as conscious and deliberate production of symptoms, as if it were feigning to gain some advantage. And I remember following a patient admitted at the ICU for PNES and educating the entire team about the diagnosis and how to handle her seizures. And however, months after her discharge, while we were reviewing some cases, a nurse from that time referred to the patient, as the woman who pretended to have seizures. And furthermore, in Brazilian medical school, there is almost no teaching about FND at all. Recently, at the University of São Paulo, a 40-minute lecture on the topic was included only in the 4th year of med school. So while this is a step forward, it is still far from sufficient. In contrast, in my opinion, we have numerous lectures on myasthenia gravis or sarcoidosis, which are serious diseases but far less prevalent than FND. So I believe that solutions should focus on educating the population in a didactic way, such as through Professor Johnston's website, neurosymptoms.org, and emphasizing the importance for universities and healthcare schools in general to allocate more time to FND in their curricula. This would help make this condition known to as many people as possible.
Oh, thank you, Lucas. That's such a great summary and such a poignant story that you shared, right? I mean, I think we've all probably had that experience with a colleague or a coworker who makes a comment about FND implying faking or feigning or malingering. And it just really kind of cuts to the core of, I think, patients and providers who are working so hard to validate this condition and provide treatment to these people who really, really need it. Thank you for really sharing that. Chrisma, would you be willing to share any additional solutions there that you could see for South Africa?
Thank you, Erica. I think I agree with what has been said. I think first and foremost, training and education is key in South Africa. I think on a pragmatic level, what we could do is to really focus on allied health professionals. We can focus on nurses. We can focus on counselors to do psychoeducation, for example, to reach a wider range of people. At the end of many of the people in South Africa live in rural areas. They don't have access to, specialized big hospitals, and they just go to the local clinic where they have access to a nurse, that kind of thing. And so in my view, I think if we can equip even at university level nurses, for example, we can reach a wider population of people with FND at the end of the day, just by psychoeducating them and by creating that awareness. There is something like FND. Have it as a consideration, as a diagnosis, and refer if you're not sure, that kind of thing. So I think that's really the main thing that I can see. And then obviously the ideal would be to work towards multidisciplinary approaches, to develop integrated care models involving the neurologist, psychiatrist, psychologist, physiotherapists, all of that. But that for me is sort of the first prize. We're not there yet. We need to take baby steps to get to those kind of things. And the last thing is stigma and misunderstanding is really a big problem in South Africa. Particularly amongst healthcare providers. But this brings me back to education. People, there's a lack of knowledge. People don't know what it is. They don't want to work with these patients. And that perpetuates this stigma and misunderstanding, and it delays care for the patients at the end of the day.
Thank you, Chrisma. Yeah, you're touching on, it's interesting. In our FNDS society, even kind of how we started, right? A few big names from big academic medical centers came, and then more people came from smaller centers. And now we're bringing in more allied professionals, and our initiatives are trying to branch out in terms of training and sharing resources, like with the psychology SIG and all these other things, right? And it's interesting that sort of our own society is also mirroring, I think, the process, the educational process, an access process that's kind of happening in across each country as well, because we're facing very similar issues here, right? Big centers have it, building it out to more rural areas, training allied professionals to have greater knowledge, knowing when to refer up, having a similar language, addressing stigma. Yeah, those are great points, Chrisma. Sanjay, would you like to wrap us up in terms of possible solutions that might exist for India? And then I want to be mindful of everyone's time, and we can wrap up after that. But existing or possible solutions in India, Sanjay.
Yes, so whatever points have been made by my colleagues also applies to India as well. But it's very important to understand that people should accept that FND exists. I have seen physicians who don't think FND exists because of the lack of knowledge, lack of awareness. So it's very important that we educate them. And we just try to let them know that, yes, FND exists, because I have been seeing patients where patients have been having functional seizure, and they have been adding one epileptic drug, one after other. And by the time they reach to us, they are already on 3-4 anti-seizure medications. So if we can make the physicians aware, that is going to be the first step. The second step, what we have experienced that works is home-based videos. We have been doing this very regularly, like asking the patients to come with home-based video, because now everybody has a cell phone and they have access to WhatsApp, and they can just share the videos of the patient, and we can educate them, we can educate the physicians. The third thing, what we have been trying, is the telemedicine. The telemedicine, again, joining the primary and secondary centers and working as a networking center. And whenever they have a FND patients, they have been sharing the videos by the telemedicine, and we have been helping to make the diagnosis. And that has really worked very well. So I think education, awareness, home-based video, and telemedicine, they are going to have great impact.
Those are wonderful solutions and potential options to improve care and access, not just in India, but I think across, the whole world would be wonderful. But you brought up one very important point, which was, physician awareness and provider awareness is important for the prevention of iatrogenic harm, right? I think there's several publications that cite how FND patients are exposed to greater iatrogenic harm risk in outpatient settings, in inpatient settings, when admitted to the emergency room, when managed with providers who are less familiar, and exposure to medications and treatments that aren't effective or interventions. And I really appreciate you bringing in the technological aspect. We haven't touched on that yet, utilizing technology in a way that increases access and decreases barriers to care. And it might also be a way to reduce stigma as well in different opportunities. But I want to be so mindful of everyone's time. I'm so sorry we're a few minutes over, but my gosh, this has just been so educational for me. I'm so grateful to hear from each and every one of you, and you guys all taking the time across so many different time zones. And we had actually 2 additional topics, but the conversation was already so rich and long. We'll have to just schedule another one where we can talk about cultural specific factors in the biopsychosocial model and international collaborations. We'll just have a multicultural podcast part 2, hopefully in the future. But I know our listeners are going to love hearing about all the services and access and issues that each of you presented. And thank you so much for your time and donating so generously to our listeners, for sure. Thank you. Physicians and providers treating functional seizures, we invite you to participate in a brief survey examining driving recommendations for patients with functional seizures. Developed by a dedicated study group, this survey seeks to capture the current opinions of physicians worldwide on this topic. Please take a moment to share your experience. A link to the 5-minute survey can be found in the show notes.